Hello and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And every week I answer your questions on office hours. So if you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. So welcome. Today we're going to be doing another office hours. I've got a lot of your amazing questions. If you have questions afterwards, you can definitely leave them in a comment on this video or on another video. I'll find them. And as a caveat, as always, before we start, I can't answer personal medical questions because I'm not your personal doctor. So I might change your question if it leans a little personal, so it's more broadly educationally applicable. So let's get started. Oh, also, if you want to work with me directly, I will leave that info below. I do work with people to help them fix the one big thing that is really interfering with their health goals. So please feel free to check that out in the section down below. So great questions. Let's get into it. First question. I wanted to try Mounjaro, but I'm young and have not had children yet. Will Mounjaro affect my future fertility? So what a great question. So as a starter to that, I think it's more widely known now, but if you didn't know, let me tell you now that tirzepatide in particular may interfere more with oral contraceptives than some of the other weight medications. So I do always like to tell people, whether they're on Saxenda or Wegovy or Zepbound or Mounjaro, any of the injectable GLP-1 medications, I always recommend, if you're a woman, if you're on oral contraceptives, have a backup method, because we're still learning how these interact with contraceptives, and you don't want any surprises. So have a backup method. That is a precursor to this question. So in general, what we have seen a lot is that weight loss tends to improve fertility, because when people are at a BMI that is probably not the healthiest for them, if it's at a higher BMI, it can really, really impact their ability to get pregnant. And so what we have found through many different kinds of weight loss, but especially when people are on these medications, you've probably heard about these like surprise babies that people are getting pregnant. Women are getting pregnant when they were really struggling with their fertility, and a lot of that has to do with their being at a lower BMI, being at a healthier BMI, and their fertility improves. So it's not really that Mounjaro in and of itself like boosts fertility or something. It's more that weight loss is very helpful. Getting somebody's BMI down to a healthier level can be very beneficial for their chances of having a baby. So, and no, it's not going to I think the other part of what this question is asking is, should you be on these medications if you want to start a family in the future? Is it going to negatively impact that? And the answer is no. These medications, the GLP-1 receptor agonists, have actually been out for many, many years to treat diabetes. And really the goal for anybody taking them is to improve their health. You can't take them when you are pregnant. You have to be off of them, and you want to be off of them for a certain window of time before you try to become pregnant. But it's not going to adversely interfere with your chances of getting pregnant in the future. So I do not worry about that for my patients who are in their 20s or 30s, and they're not at the place where they want to start a family yet, but they do in the future. For me, this is really just a tool to help them get to their healthiest self, and that healthiest self will also have a better chance of getting pregnant in the future as well, if that's something that they want to do. So thank you so much for what a great question. I'm going to start Ozempic. How do I inject it? I'm living alone, having a hard time adjusting to the effects and side effects. Okay, so this person has not started it, but they are going to, and they're worried. And I think that's a very, we hear a lot about these side effects and how horrendous they are in the news. And sometimes they are for people. A lot of people are a little scared to start it, and especially more scared if they live on their own. Like, what if I wake up in the middle of the night and I have these awful stomach cramps? There's a lot of fears that people can have. Injecting is another fear. What I do in my office is, some people, the pens are pretty easy, but some people don't like needles or they've never done anything like this before and they're just a little timid about the injection. So what I do, and you can chat with your doctor's office and see if they will do this for you, is I will have my patient make a visit with one of our wonderful nurses in my office, and they will walk them through. They will have them do their first injection in the office so they can supervise it. They can answer any questions that they have. They can make sure they're injecting it into the right place, and they can make sure they're using the proper injection technique. So if you are worried about injecting yourself, overall, it is quite easy. Harder if people are doing the Zepbound vials. Of course, that's a little more complicated, but chat with your physician and see if this is something that they can offer you as well. I think it's really helpful for people. Okay, can I stop the injections when I'm at a level I'm happy with and then take a break and then go back and start from the lowest dose? Great question. I think you are referring, is this kind of along the lines of what we talked about a few weeks ago in terms of this idea of cycling, which I have not read. I have not seen any literature for this. This falls into that kind of, these are newer medications used in terms of using them for weight. We're still figuring out protocols. Is this something that has legs? So I have not done this. I know there are lots of you out there who have. I do think, there's certainly a risk with, doing this, that you might have some weight regain. But again, usually the weight doesn't come back on immediately. So, I think as long as if somebody came to me and they wanted to try this, as long as we had a good conversation about the risks and the benefits and they could access everything and insurance and nothing kind of logistically was an issue, but they really wanted to try it, it's certainly something that I think for the right patient I would be open to. It's really like, what's the end game here? What are we trying to achieve? Are we trying to get, less side effects? Are we trying to get better results? Like, that's a very important component to figure out, like, what is the real goal? What are we looking for? How will we categorize success? That's really important to chat about with your physician. But it is, for the right patient, it's something I would be open to exploring to see if it helps, especially if maybe somebody has plateaued earlier than I would expect. Something to think about. So please keep us updated if you do try this. All right. Last question. I got very sick on Ozempic. 1 year later, I'm going to start Saxenda. Will it have less side effects? That is such a good question. So I would say in general, what I've seen is Saxenda tends to have the most side effects and Zepbound tends to have the least amount of side effects, but that is really just on a general level and certainly not at an individual level. I've definitely had patients who, with Wegovy, following somewhere in the middle there. I've definitely had patients who have more side effects on Wegovy and less on Saxenda, or they can't tolerate Zepbound. I find it is impossible to predict, really. And so in general, if somebody wants to try, maybe they didn't tolerate Wegovy or they didn't tolerate Zepbound and they want to try Saxenda, I think it's usually always worth it because you may have a completely different reaction to that and you may tolerate it just fine and have no problems. So usually I feel like it's worth trying. You never know until you try. But you can never say for certain if somebody will have or won't have the side effects. But definitely worth a conversation with your physician. But for me, if I have a patient that wants to switch things like that, and we've kind of maxed out the possibilities on one of the medications, then that's a natural next step. What a good question. That's going to do it for today. Thank you so much for watching. If you want to work with me directly, I will leave that info below. Thank you so much for your questions. If you have questions afterwards, again, just leave them on this video or on another video. And thank you so much for watching, and please be well.